So the cornea curvature needs to be changed. The cornea has thickness, and it's about 500 to 600 microns thick. But by analogy, let's say it was a telephone book. Let's say we had a telephone book here that was too curved and too steep, and we wanted to flatten it. By analogy, in LASIK, what we're going to do to the phone book is we're going to open the phone book up to about page 120. And that's the creation of the flap. So the surface layer of the cornea is temporarily removed out of the way so that the laser reshaping can be done on the inner corneal layers, or by analogy of the phone book, page 121 and deeper. So once the flap is created, or to create the flap, you'll feel a little pressure usually, you hear a little buzzing noise, and that's about it. And then when the flap is peeled back, you don't feel that at all, and you just see the character of the light in the room change. Then the laser is done to reshape the intercorneal layers, or by analogy, the deeper pages in the phone book. To do the laser, as a patient, you just look at a red light. The computer is making sure that you continue to look at the red light. We have tracking mechanisms in the laser. If you happen to look away from the red light when the laser's turned on, the computer senses that, shuts down the laser. The doctor typically says, hey, what are you doing? Let's look at the red light. The patient goes back to the red light, and then the treatment picks back up again. When the treatment is being performed, you just hear a tapping noise. It kind of goes ting, 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 like that. And that's it. It's completely painless. People in general don't have any trouble looking at the red light. It's not overly bright or anything. And it's the surgeon's responsibility to keep everything lined up and focused and centered correctly, and make sure the patient is calm and not moving. The duration of laser treatment depends on the amount of refractive error, or the amount of focusing error that a patient has. But in general, it can be as little as 10 seconds and as long as a minute and a half. After the laser is completed, which again is painless, the flap is laid back down. And then the doctor does a few things to make sure that the flap is situating itself properly and perfectly. And then that's it. The patient returns to the relaxation room and then is looked at one more time by the physician before going home.